Hello and welcome everyone to Women's Health Tech Wednesdays. I am your host, Nina Joshi. I would like to formally introduce today's guests, Jenny Spinks Martin and Ashley Filippo from Recovery Plus. Thank you both so much for being here today.
Hi, thank you for having us.
Hi, everyone.
Absolutely. Hi, all. Maybe to kind of kick things off, would love if you could both introduce yourself, kind of talk a little bit more about the work that you do at Recovery Plus and kind of what led you to where you are right now. And maybe, Jenny, we can start things off with you.
Yeah, sure. I'm Jenny Martin. I am the Chief Nursing Officer and Family Nurse Practitioner with Recovery Plus. I have been with Recovery Plus for right around 7.5 years. I've been working in healthcare for just under 10 years. And I started in cardiac rehab. And kind of what led me to being here is I originally worked in cardiac rehab. I saw these huge barriers to care, and I wanted to change that. I wanted to make a difference. I wanted to bring that to people that needed it, the 80% that's not getting it. So that's why I'm here.
That's amazing. And Ashley?
Hi, everyone. I'm Ashley. I am the VP of Partnerships here at Recovery Plus. My background is I'm an occupational therapist. I've actually worked in oncology for about the past 10 years, pretty much across the continuum of care, inpatient, outpatient, ICU, you name it. And then similar to Jenny, actually, after COVID, I really started to recognize all the barriers to care. And I actually found Recovery Plus through HitLab as I started to look into new health tech innovations, healthcare startups that are really that are mission driven to improve access.
That is incredible.
Yes.
Oh, go for it, Ashley.
No, I was just say it's always nice to kind of be back because this is where I found the company in the first place.
That is amazing. We love to see that. And I think on that note, would love if you could share a little bit more with us about, what is Recovery Plus, kind of walk us through the platform a little bit and what it, really aims to achieve when we think about just access to care and some of those metrics too.
Absolutely. Yeah. So Recovery Plus at the core is a home-based cardiac rehab and chronic care management, where we also manage patients through remote patient monitoring. So all of our patients have individualized, personalized care plans where they can receive hour-long exercise sessions, access to a nurse practitioner, dietary services, as well as weekly or biweekly calls from care managers that check in on them. How are you feeling? How are you sleeping? Are you taking your medications? Really to ensure that it's a holistic approach and all the bases are covered. Then what drew me to the company is that it can provide preventative care, rehab, and maintenance. So once the individual is on program, they're on it, they can be on it for the rest of their life. So that is a small snippet of what we do here. And then we also recently opened a clinic in New York where we're also providing some inpatient services, in-person services, as well as cardiopulmonary exercise testing.
Oh, wow. That's amazing. I love that it really seems to be this kind of spectrum of care, like you had mentioned, starting from prevention kind of through maintenance. That kind of, I'm so curious, really, when we think about, for you both, how are you ensuring that, the team provides this level of personalized care to patients, that are going through, whether it's cardiac rehab or some of the other chronic conditions that you were alluding to at Recovery Plus? Because I would imagine the personalization aspect is probably so at the core. So yeah, really curious about that piece. And maybe Jenny, we can start with you.
Yeah, sure. So one of the things that we do is we spend a lot of time with our patients in the beginning discussing their current knowledge base of their conditions, their medications, kind of what their personal barriers are. Everybody's a little different on what is keeping them from potentially getting the access of care that the level of care that they need. So we spend a lot of time discussing that. We set very personalized goals with the patient. We want to know what is it that they need to be able to do, what is it that they can't do, and what's actually stopping them from getting to those goals. We also know that with chronic conditions, it's not just the physical aspect that is struggling. There's also the emotional, the mental, just overall quality of life. So when we look at setting goals and working with patients and creating this very personal level of care, we want to not only improve their physical health, but we also want to overall improve that quality of life. So that's how we personalize it. It's very different per patient and what they need and what barriers they have.
I love that. That sounds so kind of personal and very, sensitive to these very like these individual behaviors and kind of personal goals. I really love that approach, kind of going beyond just the medical or kind of just the hospital aspect of it all, which I think is incredible.
Right, absolutely. And you don't know what their gaps in knowledge are, or their gaps in care are until you really sit down and talk with them. And it really is important to do it while they're at home. That's usually when they'll tell you the most.
Oh, I love that. That's really smart. Yeah, just kind of being able to, I would imagine it's probably so enlightening just to kind of step into their world and see kind of their perspective when it comes to just managing their overall health and wellness.
Absolutely.
That's amazing. And actually kind of curious too, from your perspective, since I know you work a lot in the partnership space, for you, how are you kind of ensuring this personalization or really just this overall client-centered holistic approach when it comes to just broader healthcare at Recovery Plus?
Yeah, absolutely. So the main partnerships that we're really focusing on right now is different cardiologists across the entire country. And depending on where you are, people have different needs. So the founder of Recovery Plus actually is from a very, very rural area of Texas where the nearest cardiologist was 200 miles away. And in order to get to cardiac rehab, family had to take off work. They had to, spend hours driving back and forth. So it really depends on who the person is, what they need, and what resources we can get them. So what we do is we provide each individual with a Bluetooth heart rate monitor and a cellular blood pressure cuff so that they can upload their vitals into our system daily. So all of their care is personalized based on them in each day. And then that we can also access their cardiologist and get them the care that they need. So each day is a different day, and we kind of address the patients where they're at and get them the resources that they need.
That is incredible. That's amazing. And I would imagine that you're those little small, barriers to access and kind of being able to use technology in this really great way to kind of remove some of that and just continue to make it easier and easier, I would imagine is so great in the long run. That is amazing. And Jenny, I wanted to kind of touch on something that you had mentioned a little bit earlier, kind of speaking to like the knowledge base that kind of you're seeing in patients. I would imagine that education is so key when it comes to just, whether it's the initial prevention all the way to maintenance for these chronic conditions. For you, what are some of the strategies that you employ to kind of educate patients about, the chronic disease process or really what to expect? What does that kind of look like for you?
Yeah, so I think the first thing, it all stems to that initial conversation where we're really truly assessing. Not only am I looking at what do they not know or what do they know, I'm also going to be looking at how do they learn best? Do they need written material? What is their digital literacy level? If I were to send them something through the app, is that going to be clear enough for them? Is it big enough print? Those are all things that play a really big part into just knowing the patient and what they really need. They get all this information on discharge or from their doctor. And then sometimes the font is, it's 8-point font. Well, they can't read it. So it's not that they couldn't read it. It's just that it's too small. So I'll actually take that information, I'll blow it up bigger, and I'll either email it to them or send it through the app, or I'll mail it to them. I mean, whatever it takes to get these patients educated. On the same token, right, it's how do they learn best? Do we need to do it in small pieces, big pieces, the big picture? So we really truly look at personalizing their education, repeating the education. So every time we talk to them, somebody is saying a tidbit of that information that we want them to know that's really important to their care. And then also active learning, making sure they're engaged, making sure they're asking questions and providing follow-up. So those are a lot of the ways that we really focus on personalizing education.
That is incredible. Just the fact that you are taking that step to really about how they, view different education materials, what they like, and all of that, I think is already like so huge and not common, which is sad and surprising. So it is really incredible that you and the team really takes the time to understand how people like to receive information, how they like to learn. I think it's amazing how uncommon that is. So big kudos to you both for that.
Thank you.
Thank
And
you.
it's nice because, like I mentioned, we do have these care managers, and they really get to know these patients. So they're on the phone with them once or twice a week, just like we are now. They know each other. They know about their kids or their dogs or whatever it may be. And they're repeating the same thing every week to really ensure that repetition, so that it's retained and the patient gets the best care and is understanding what the care they're getting.
Absolutely.
Yeah. And one of the things that I've really, I would say probably emphasized is not only do I want them to know what conditions they have and what medicine they're on and why they're on it, but I also want them to know if they were to go to the doctor, what questions should they be asking? So a lot of times you don't know what you don't know. And so we spend a lot of time on those pieces of that piece of the puzzle, which is what should I ask when I go to my doctor? Well, I had these symptoms, but I thought they were normal. So we really spend a lot of time educating on that and how to better communicate their needs and their questions to their providers as well.
That is incredible. I would imagine, really just being able to empower patients with that information and education probably goes such a long way.
Absolutely.
Wow. One of the other things that I think, Ashley, you had mentioned is really around the virtual kind of cardiac, but also kind of the pulmonary exercise training, whether that's virtual. And I know that it's now a kind of in-person option for folks in New York. Could you share a little bit more about kind of that program and how you all are going about some of the rehab and training components? And I'm really specifically curious about the telehealth or the remote aspect of all of that.
Yeah, absolutely. So when each patient onboards, as Jenny mentioned, it's very personalized care. So they're going to get different equipment based on what their diagnosis is and their functional status. So a lot of patients are getting a blood pressure cuff, a heart rate monitor, a pulse ox. They might get a glucose monitor, depends on what their conditions are, as well as a water bottle in a nice Recovery Plus box. That's always fun to get and open up. And then we have exercise physiologists across the entire country, which is really nice because it allows us to be flexible with timing. If a patient wants 6 a.m. Eastern time, Pacific time, 6 a.m., whatever it may be, we can really make it work. And we send all the patients a telehealth link, so it's on an encrypted platform, nice and secure. And we go through a battery of assessments to start 6-minute walk test, a tug test, and different questionnaires. So we get a nice baseline assessment. And then the individual will work with the exercise physiologist one-on-one with the equipment they have. And again, as Jenny mentioned, we're super personalized. If the person wants to get back to playing pickleball, we'll work on goals to get them there. If they want to get back to lifting their grandkids, we'll work on strengthening there. But it really ranges, and we'll get patients that are super active running marathons to individuals that live a more sedentary life. So again, really personalized care. We use the equipment that they have available. We can get really creative and ensuring that we're working on, their cardiovascular goals, their pulmonary functional status, based on the latest research, the latest data. We're doing a lot of zone 2 training, high intensity interval training, strength training, balance, whatever that patient needs. We'll incorporate that into their exercise protocols. And again, all virtual. So if they're traveling, we can come with them. If they're home, we're there. If it's the holidays, we're there. So we really want to ensure that the patients are being seen each week, regardless of what they have going on.
That is amazing. And I'm curious because I think when I think of working out at home, I'm immediately getting COVID flashbacks of when we were all kind of doing our YouTube workout videos at home. And I'm kind of curious because I think, Jenny, you have been with Recovery Plus since before the pandemic. I'm kind of curious, do you feel like the tech adoption for that type of, this type of behavior, do you think it's kind of gotten a lot better with kind of COVID almost like changing our brains and making that so much more accessible? Or do you feel like it's been pretty consistent with folks that are part of Recovery Plus when it comes to just like consistency and adoption for exercise training virtually?
I actually think that no, it changed the world for us so much, because before the pandemic, there was kind of this, especially in the older population, of, well, you can't do that through the screen. There's no way. Well, then the pandemic kind of forced us to be able to see any doctor. You had to do telehealth for so long.
Right.
And so what it really did is it opened up the mindset of, this is acceptable and this is reasonable, and this is actually, oftentimes it can be even better, because you're not exposing patients that shouldn't be exposed to sun sicknesses, and you're also bringing it to where you are, and you're decreasing a lot of those barriers, which is transportation, time. People don't have to leave work to go to a doctor's appointment. They don't have to leave work to go to cardiac rehab now, because they can do it in their office. So I really do think that it actually kind of accelerated the acceptance of what we were already doing. And more people just are now saying, okay, this actually works, right? My doctor was doing it, so then it must work. And it does. We've known that it works, but it just kind of became more acceptable after the pandemic.
Totally. Yeah. I think that, go for it, Ashley.
No, I was gonna say, I think you touched on a good point too, is the compliance. A patient every Tuesday at 11 o'clock, I log on, doesn't matter where I am. So it really helps with our compliance rates too. And we found that people are not only enjoying it and staying on the program for months and years, but they're like 85% compliant, which is a really great number. Yeah.
Really high. In traditional settings, it's actually 80% of the population that doesn't even go, that needs it. But we have an 85% compliance rate, meaning they not only show up, but they stay in the program for an extended period of time. So yeah, I think even from a provider standpoint, before pandemic, it was kind of this question of, can you really do that? We would get those questions. How are you really doing that? How are you really monitoring your patients? And then it became a necessity. And now, even from a provider standpoint, I think more providers are even more open to this concept of being able to do this and monitor effectively through technology.
Yeah, that's incredible. And I think speaking to technology, I'm kind of curious. I would imagine, Ashley, you were kind of speaking to all the different devices that you're getting, and now with, the exercise program, I would imagine, the dietary kind of programming that you have. What is kind of the approach when it comes to just the integration of these technology solutions in a way where it still does feel like it's, person-centered and all of that too? I'm just kind of curious if there's kind of a specific approach in mind when it comes to utilizing tech.
Yeah, absolutely. So we've also built our own EHR system. So the cardiologists have access to monitor their patients through us. So we really want to personalize the care, not only for the patients, but for their doctors and for what they want to view. Right. So if one physician wants to view blood pressure, we'll ensure that that patient is getting a blood pressure monitor. And again, it's cellular. They don't even need Wi-Fi. So very personalized in that matter. So yes, again, blood pressure, heart rate, pulse ox, meal logs we have. And the patients do have access to an app as well, if that's something that they're interested in, where they can log and track their own numbers as well.
That's wow. I mean, it's great that there's all of these different modalities and that it's really kind of centered around what is just for the physician and the patient, what's just going to make the most sense.
Absolutely.
Right.
That. And I kind of wanted to go back to something that was at the very, very beginning of our conversation, really talking about that spectrum from prevention to maintenance. And kind of, I know we were talking a lot about the rehab specifically and all of the great work that's being done for that. And I would imagine how it extends into maintenance. But I'm really curious about the prevention piece. How are you all at Recovery Plus kind of thinking through just prevention, and what does that look like? Because I'm just personally curious as myself who, wants to look out for it.
Yeah. So I think that one of the key things is prevention is knowing your numbers. And that's one of the key things that we educate on is just because your numbers look great, right? Let's say you get labs and everything looks great, but let's say you have like a little bit of high blood pressure or you're pre-diabetic. So most of the time, your primary care will just say, make some changes, but there's really like change your diet or exercise more. One of the things that we do is we give you the tool to know what to do. What does that even look like? And knowing your numbers. So let's say you go in and you're pre-diabetic, they're going to say change your diet, change your exercise, but then they don't have you monitor anything. Well, we want to start monitoring now because, for example, a fasting blood glucose every day is going to tell me a really good idea of what your A1C, which is that 3-month average, is. So I want to know what your numbers are because I don't want you to ever get to the point where you need medication. I actually want to be proactive. I want you to know what foods you're sensitive to, what foods are causing your blood sugar to go up. Let's get ahead of that. Let's start making those changes. Let's meet with the dietitian. And then here's your exercising tools. It's not just like, it's not that simple for everybody just to go exercise when maybe you've never exercised a day in your life. You walk and that's it. And that's great, but we're able to provide you those resources and that support. And that's kind of one of our main focuses is know your numbers. Here's what you need. Here's your resources. Here's the tools. And then we check on you through the way. The other thing that we really do, and I think has been really probably a common question on when we talk about preventative care in Recovery Plus. And I want to say that that's probably why we actually opened a brick and mortar facility. Not only does it go along with our model of, we just want to bridge the access. We want to bridge the gaps. We want to close the gaps, which is facilities, time. There's not enough facilities. We want it to be more flexible, but we also want to focus on prevention. So in our facility, our patients have the ability to do, for example, they can come in once a month instead of 3 times a week. And then the other sessions can be done virtually. But we also have our cardiopulmonary exercise testing, which is what we use to really look at a very, very sensitive test to tell us, is there anything underlying? So we do have to do that test in person. It's using a stationary bike and a really fancy piece of equipment. So that's kind of one of the other steps that we've taken to get really more honed in on that preventative care. So it's so sensitive. We can detect underlying endothelial dysfunction and then get ahead of it, adjust exercise, adjust diet, and make those changes that we need to make.
That is incredible. And I think you bring up such a good point, I think, when we think about primary care and really some of the instructions that we get, but it doesn't really, there's no further details into the how you go about doing something like that. So I like that you all are really focused on like the nuts and bolts of how do we actually make those positive changes and move the needles in a specific way,
right?
Which I think is, so powerful. I do see that. Oh, Ashley, go for it.
Yeah, I just wanted to add to that really quickly. Also, the program's also covered by insurance. And in order to enroll, the person only needs 2 chronic diagnoses. So that can be obesity and hypertension. That can be, obesity and diabetes. It could just be hypertension. So typical cardiac rehab, you need to have had a cardiac event. You need to have an ejection fraction of less than 36%. So this, again, really from a preventive standpoint, opens the doors for so many people that would not be eligible for cardiac rehab or rehab in general that now can get that preventive care to prevent an event from happening in the first place.
That's huge. That is very, very cool. Yeah, thank you for sharing that, Ashley. That I think that I could imagine is so impactful when it comes to just access and kind of having this program available to more people. And I think on that note, I do see that we are like 3 minutes out, which is crazy. I really wanted to maybe end and kind of ask you all, I would imagine, when you think about from prevention to rehab to maintenance, all of this and how, community plays probably such a big role in, making sure that people are hitting their metrics and staying connected. Is there kind of any work that's being done for Recovery Plus when it comes to things like community engagement and kind of, having those connections fostered between the patients?
Yeah. So one of the things that we're actually there's a couple of things that we're looking at implementing over the next several months.
Ooh.
One is we do want to start having group therapy sessions. So being able to do similar to what a Zoom would be, but through our secure telehealth platform, where the patients can all join and they can do a session together, and they'll have an exercise physiologist leading it. And let's say it's 10 patients, one exercise phys, where they can talk, but they're still exercising and learning new things and learning about each other's experiences. We're also going to have group registered dietitian webinars as well, where our dietitian talks about heart healthy and diabetic healthy diets, as a community through our patients, which right now I want to say we're right around 1,400 to 1,500 patients. So it's a very large community. And then the other thing is we are looking to bring on mental health services, where we do support groups and have counseling services as well for our patients. So those are all some things that over the next few months we're looking to start incorporating.
That is very cool. That's amazing. And I would imagine like the mental health piece and just kind of having folks come together to know that, there is a community, and the fact that you have so many, I think is just so incredible that there's this amazing team that's rallying, behind them. I would imagine is so empowering.
Absolutely.
That is incredible. Well, I see that we are at time. I just wanted to thank you both, Ashley, Jenny, for taking the time to chat with me today. And share a little bit more about the work that you do, but also this incredible platform that is so accessible and available. So I really appreciate you, taking the time to chat with us today.
Absolutely. Thank you so much for having us.